Hello everyone, today the topic which we're going to study is Scleroderma. Scleroderma is also called as systemic sclerosis. What is Scleroderma? Scleroderma is a connective tissue disorder characterized by fibrosis and degenerative changes in skin, vasculature and internal organ. It is actually an autoimmune condition which lead to excessive collagen production. Due to excessive collagen production, there will be widespread fibrosis. So what is the pathogenesis of this excessive collagen production? It involves three processes. The first one is the vascular changes, the second one is fibrotic change, and the third one is antibody production to nuclear antigen. In vascular changes, due to autoimmunity, there will be a vessel wall inflammation. Due to inflammation, there will be the damage to an endothelial cell. This damage in endothelial cell will release cytokine and endothelin 1. This endothelin 1 will cause vasoconstriction and the cytokine will act on a fibroblast and cause fibrotic changes. In fibrotic changes, the cytokine which stimulate the fibroblast will synthesize collagen, primarily type 1 and type 3 collagen. Along with type 1 and type 3 collagen, the fibroblast will also produce fibronectin and glucose aminoglycan. Due to production of these substances, there will be fibrosis in dermis and internal organ. Apart from that, there will be an antibody production to nuclear antigen. So these antibody can be detected in serum. Due to fibrosis in dermis, there will be characteristic changes in skin. In skin, there will be a thinning of the epidermis and there will be a diffuse thickening of dermis. Due to these changes, there will be a characteristic finding in face and hand. In face, there will be a lip thinning and retraction, and in hand there will be a diffuse fibrosis which lead to puffy hand which are hard to bend and the skin became shiny, and the thickened skin will be hard to pinch and there will be a loss of wrinkles, and in later on the hand will appear a shape of a claw called as a sclerodactyly. You can see the lip thinning and the sclerodactyly in this image. Scleroderma, like other autoimmune conditions, are more common in female. The female to male ratio is 4:1 and the average age of onset is about 30 to 50 years of age. Scleroderma primarily manifests in two forms. The first one is diffuse cutaneous systemic sclerosis, also called as a diffuse type, and the second one is a limited cutaneous systemic sclerosis, also called as a CREST syndrome. Remember that these two forms represent a spectrum of manifestation. At one end there is a limited form and at other end there is a diffuse form. The limited form is usually a benign condition and the diffuse form represent a more severe disease, but most of the patients are present in between these two forms. Now firstly we will discuss diffuse form and later on we will study the limited form of systemic sclerosis. In diffuse cutaneous systemic sclerosis, there will be skin manifestation which will be later followed by a Raynaud phenomena. What are the skin manifestation? In the skin manifestation, it will primarily involve the face, trunk and limb. In face, it will cause a thickening of a skin which will lead to a loss of wrinkle and thinning of lips. In trunk, there will be a thickening of chest which is called as a Roman breastplate chest. Hand, due to a diffuse thickening, there will be a sclerodactyly which represent a claw-like shape of a hand. It occurs due to widespread fibrosis of hand. Remember that this pattern in which there is a skin manifestation which is followed by a Raynaud phenomena is characteristic for the diffuse form. Apart from skin manifestation followed by Raynaud phenomena, there is also early involvement of viscera in diffuse cutaneous systemic sclerosis. The viscera most commonly involved in this type is renal, GI, heart and joint and pulmonary system. In renal, it causes a renal crisis which is a rabid malignant hypertension. It is a very serious complication but it is rarely found these days. In GI system, it predominantly involves esophagus. In esophagus, there will be a reflux disease and heartburn. Apart from that, there will be a decreased peristalsis and there will be a weakening of lower esophageal sphincter. In heart, it can cause pericardial effusion, myocardial involvement which will lead to congestive heart failure and arrhythmias. In joint, it causes inflammatory non-erosive arthritis. Apart from these things, the last system which is involved in diffuse form is the pulmonary system. In pulmonary system, it causes pulmonary hypertension and interstitial fibrosis. The pulmonary hypertension can lead to right-sided heart failure. So we do regular cardiac monitoring in a scleroderma patient for right-sided heart failure. In interstitial fibrosis, there will be a honeycomb appearance of lung on chest X-ray and there will be a shortness of breath. After diffuse form, now come toward the limited cutaneous systemic sclerosis, also called as a limited form. In limited form, there is an involvement of skin, but the involvement of the skin is usually below knee and elbow joint. It also causes a Raynaud phenomena. But remember that in this case, initially there will be a Raynaud phenomena, and later on there will be a skin manifestation. It is opposite of a diffuse form. It is also called as a CREST syndrome. The CREST is a mnemonic in which C stands for calcinosis, R stands for Raynaud phenomena, E stands for esophageal dysmotility, S stands for sclerodactyly, and the T stands for telangiectasia. So these are the characteristic feature of limited form. So that is why it is called as a CREST syndrome. So let's discuss CREST now. In CREST, the C stands for calcinosis. The calcinosis is a calcium deposition in subcutaneous tissue. Due to deposition, there will be a bump on elbow, knee, and finger. This bump can break and there will be a leakage of fluid from this bump. On X-ray, it represents as a soft tissue calcification. The R stands for the Raynaud phenomena, which I discussed previously. The E stands for the esophageal dysmotility. In esophageal dysmotility, there will be a difficulty in swallowing, which will cause reflux and heartburn. In manometric finding, there will be a decreased peristalsis and there will be a lowering of pressure of lower esophageal sphincter. The S in CREST stands for a sclerodactyly. The sclerodactyly is a claw-shaped hand which I discussed in a diffuse form. The T in CREST stands for telangiectasia. Telangiectasia is a skin lesion in which there is a dilated capillary present in face, hand and mucous membrane. This is a classical feature of a CREST, but it can also be found in a diffuse form. You can see the telangiectasia in this image. So it was all about a CREST syndrome. The CREST syndrome is usually a benign disease which show a good prognosis, and it do not involve heart and kidney, and it predominantly involve lung. In lung it causes pulmonary hypertension. The pulmonary hypertension is about 6 times more common than diffuse form. Apart from pulmonary hypertension, it can cause interstitial fibrosis, and it is the most common cause of death in CREST syndrome. Now come toward the diagnosis of a scleroderma. Scleroderma is usually a clinical diagnosis, but apart from clinical feature, we can perform certain lab tests. The first one is the anti-nuclear antibody test. It is usually performed, it is highly sensitive, but it lacks specificity because it is present in other autoimmune condition. Apart from this, the second one is the anti-topoisomerase 1 antibody. This test can also be performed. This is also called as a anti-sclerodermal 70, and is the most specific for diffuse form. We can also perform the anti-centromere antibody in which is more specific for the limited form called as a CREST syndrome. The last one is the anti-RNA polymerase 3 antibody. It can also be performed and is specific for the diffuse type, and it is usually elevated in those patients who have a renal involvement. After diagnosis, now come toward the treatment of scleroderma. Remember that there is no effective cure. We treat symptomatically. In symptomatic treatment, we target the specific symptom. If there is a esophageal reflux disease, we use H2 blocker and PPI. If there is a Raynaud phenomena, we use the calcium channel blocker. And if there is a pulmonary complication, for pulmonary hypertension, we use a bosentan, which is a competitive antagonist of endothelin 1. And for the pulmonary fibrosis, we use a cyclophosphamide. And if there is a renal crisis which is predominantly occurring in a diffuse form, we use an ACE inhibitor. So it was all about the scleroderma. If there are any question, you guys can ask, and stay tuned for more update.